In this section, we're going to look at anatomical positions and directional terms. This is more of a lab thing, so you may have heard me discuss this in lab, but these are things you're going to want to know and need to know. And to some degree, these don't go away. You know, once you get into practice, whether it's private practice, hospital, or some other doctor's office, these terms are thrown around quite a bit. Okay, so well, first of all, visualize a person standing in front of you with their palms facing you. That is considered anatomical position. Okay, you're seeing a silhouette of it on this picture. We should see some more details of it later. But that's the first step, is always reference a person in that position. Standing in front of you, palms facing you, okay? Now, whether they're face down on a gurney, face up, sitting backwards, facing away from you, facing towards you, these terms apply always in anatomical position, okay? So, the first thing there, superior is going toward the head, inferior is going toward the feet. So if you're palpating, let's say you're palpating the chest, your hand is right in the middle of their chest and you're doing a chest exam. If you palpate or work your hands from the middle of the chest toward their head, you are moving superior. Okay, back to the middle of the chest with your hand. If you're moving or palpating inferior, which means now you're over the abdomen, now you're moving inferior. Okay. Anterior is toward the front. It's also known as ventral. Posterior is going toward the backside. Also dorsal, aka is dorsal. Actually, back to superior, it's aka is cranial or cephalad. Inferior is aka is caudal. Okay, so do know both the AKAs. Okay, medial is working toward the midline. So if you're palpating, let's say the left shoulder, and you start palpating, working toward the sternum or the middle of the chest, that's working medially. Okay, if you're in the middle of the chest or over the sternum and you're going to palpate toward the shoulder, you're moving lateral. Intermediate is between, like kind of in between medial and lateral, is considered the intermediate. Proximal is closer to, distal is further away from. Now this one is tricky because you need two reference points. Okay, now visualize the femur, if you will. The femur is your thigh bone. The proximal end of the femur is the femoral head, like where it goes into the hip, the ball and socket joint area. Another way to visualize proximal versus distal is always reference the heart. What structure is closer to the heart? What structure is further away from the heart? So going back to the femur, if you use that reference, where's the proximal end? Well, which one's closest to the heart? Well, the answer is that ball and socket area, that part of the femur. And then the distal part, or the area furthest away from the heart, would be the end of the femur where the kneecap is, where it's about to connect to the tibia. Okay, so that's the distal end of the femur. And that concept applies to anything. You know, we can use the radius, for example, which is a forearm bone. The proximal end is by the elbow. The distal end is by your wrist. Okay, superficial is more on top of. Deep is deep inside. You know, example would be if you get like a basic everyday splinter in your finger, that would be a superficial splinter versus, say, a gunshot wound that went deep inside near the spine, that would be deep. Okay, so superficial versus deep. Okay, there's your anatomical position. So the lady on your reading left, that's palms facing you, standing in front of you. That's considered anatomical position. Okay, your planes. This one is a little tough. It's something you have to go over several times. And I think I have a video posted on this, so make sure you look at that. So in that figure A there, that particular plane, that is the median, also known as the sagittal plane. Okay, so that divides a person into equal right and left halves. In B, that is the frontal, also known as coronal plane, so make sure you know the AKAs. That divides a person into equal front and back halves. And then the transverse plane in C divides the upper from the lower. Okay, so these are the different planes that we have. All right, the body is studied into 6 general levels. I do want you to know these 6 general levels. These are very important. In fact, make sure you write down before number 1 chemicals there. Write down atoms and molecules, because the atoms and molecules, if enough of those are put together, you get the chemicals. And if enough chemicals are put together, you get cells. And if enough cells are put together, that creates tissue. If enough tissues are put together, that creates an organ. And if enough organs are put together, that creates an organ system. And then finally, if enough organ systems are working together, then you have the organism, or the human. Okay, now, the other reason why I want you to know this is because when we get hurt, pathologies and illness and disease, it's the cells that get hurt first, which means you don't feel it yet, but it's there, it's in the making. And when enough cells get hurt, then tissue gets hurt. And when enough tissue gets hurt, then the organ gets hurt. And usually at this point, this is when you become symptomatic. And then of course people will probably do the typical, just painkillers, ignore it, whatever, I can live with this. But all the while, the organ is getting worse because the atoms and molecules are getting worse, which means the chemicals are getting worse, which means the cells are getting worse, which means the tissue continues to get worse, and the organ's getting worse, and now organ systems are starting to fail. And then eventually the organism, or the human, is now failing. And usually this is when they go in. And the docs are like, why didn't you come a long time ago? You let this get really bad. So unfortunately, with that particular model, we call that the pain model, and it's not really preventative care, it's more symptom care, meaning people just don't do much until it really hurts. And by that time, there's been a lot of tissue damage, a lot of cellular damage, and now they feel it, and now they're symptomatic. So now there's a lot of work to be done. Okay, do know the 11 major organ systems that we have. Just be able to identify this on a test. If I give you like a multiple choice answer, what are the 11 major organ systems? Well, here they are. The integumentary system all the way down to reproductive. And to some degree, this is in no particular order. This is just the systems that we have. In ANP1, we're going to go over the integumentary system, skeletal, muscular system, and nervous system. And then in ANP2, you do the rest. Lymphatic, respiratory, digestive, endocrine, cardio, urinary, reproductive. That would be ANP2. So between ANP1 and ANP2, you'll cover all of these different systems, and then the subcategories within the systems.